Welcome back to the Noon Show on WBAY-TV2, and welcome to Ask the Expert. With a familiar face with us today, Dr. Tyson from Tower Clock Eye Center is with us. It's great to see you again, Doctor.
Hello.
Let's talk about somebody coming in to see you. This is going to sound as petty and silly as possible, but I don't want to be inconvenienced. I can't see. I might need cataract surgery, but I want to get back to my life as I know it as quickly as possible. I'd imagine you deal with that a lot.
Yeah, I think that's a very common issue, and certainly as we do cataract surgery on younger and younger patients, because certainly as we get older, lifestyles, people are staying healthier. They want to continue to engage those lifestyles. They don't necessarily want to take time off from work or take time away from vacation, their exercise routine. So it's a pretty easy conversation for us to have with people.
I would imagine as the technology has gotten better, recovery time, returning to regular life, so to speak, becomes so much easier for people, and probably the joy of doing these types of surgeries for you.
Absolutely. We can look at just operative time. So from the time somebody comes to the surgery center to the time they leave, it's probably about 2 hours or less. We're using sedation techniques, just oral sedation, no more IVs. These are very fast-acting agents. They can go back and feel normal for the rest of the day. In terms of restrictions after surgery, basically it's nothing, and that's about what I tell patients. They can go back to their normal routine the day after surgery. Dropless cataract surgery, in a majority of patients, they don't need to use eye drops after the operation. So that's a time savings, and quite frankly, it's simply a better way to do cataract surgery.
So really, sitting down with a patient, getting over that initial hurdle of the unknown is
Correct.
Restoring the realistic expectations for them, which are probably better than what they thought.
Yeah, absolutely. So, that's a big inconvenience if they've got a trip coming up and they want to get their surgery done. A lot of our patients go south for the winter, and I tell them, as long as you're comfortable, I think you can go ahead and leave the area within a week after the operation.
How does a person begin the process with you to have this discussion?
Well, quite frankly, I think in terms of contacting us, they can go right to our website. We've got a great amount of information there in terms of just beginning that self-education process, which I love to see. Try to learn a little bit about the different ways to do cataract surgery, the different lenses. Come on in, challenge us with questions, read everything you want to read on the internet. I love answering those questions.
Getting a hold of Dr. Tyson or anyone at Tower Clock Eye Center is as easy as following the information right there on your screen. We'll get you back into the Noon Show here on WBAY-TV2 right after this.